Hello and welcome. Today we are going to talk about a very important topic, especially for older adults. We will discuss the dangers of using homemade herbal remedies without proper guidance. Many people think that herbs are always safe because they come from nature. But the truth is, just because something is natural does not mean it is always safe. Over the past few years, more and more older adults have turned to herbal remedies. Maybe you are tired of taking too many pills. Maybe you have heard that certain plants can help you sleep better or feel more energetic. Maybe you saw a video online or a neighbor shared a recipe for a special tea. It is very tempting to try something natural, especially when it promises relief without side effects. But we need to be careful. This video will help you understand why. We will look at why older adults are turning to these homemade remedies, what they are, and the real risks that come with using them. We will also go over some specific herbs that can be dangerous, even though many people believe they are harmless. Finally, we will give you tips on how to use herbal products more safely in case you still want to try them. Let us begin by asking this question. Why are so many older people trying herbal remedies in the first place? There are a few simple reasons. First, many prescription medications come with side effects. You might feel dizzy, tired, or have stomach problems. After years of taking these drugs, it is natural to want a break. You may think, there must be a better way. Herbs seem like a gentler option. Second, many people believe that natural is better. They think that if something grows in the ground, it must be safe to eat or drink. This is not always true. Some of the most powerful poisons also come from plants. The line between medicine and poison is often the dose. Third, the internet makes it very easy to find home recipes. One quick search can give you dozens of ideas for herbal teas, homemade capsules, or oil mixtures. Some websites look very professional, but not all of them are run by doctors or trained professionals. Some advice might be harmless, some might be very risky. Fourth, friends and family often share remedies that have worked for them. You might think, well, if it helped my sister sleep, maybe it will help me too. But our bodies are all different, especially as we age. What works for one person might not work, or might even be harmful for another. Now let us talk about what we mean when we say DIY herbal remedies. DIY stands for do it yourself. These are herbal remedies that you prepare at home. You might make a tea from leaves, a tincture by soaking herbs in alcohol, or a paste using powder and oil. You might grow the plants in your backyard, or buy dried herbs from a local market or an online store. Some examples include chamomile tea for sleep, ginger tea for nausea, turmeric paste for joint pain, peppermint oil for headaches, echinacea tea to boost the immune system. These all sound gentle and safe, but the problem comes when people start using herbs without knowing the proper amount, without understanding possible side effects, and without talking to their doctor, especially if they are already taking other medicines. Let us move on to the first big danger: incorrect dosages. Unlike prescription drugs, herbal remedies are not always clear about how much you should take. Even when you find a recipe online, the amount can vary a lot from one website to another. A tea bag from a store might have a small amount of herb, while a homemade brew might have 3 or 4 times more. That can make a big difference in how your body reacts. Let us look at one simple example: licorice root. Many people use licorice tea to help with digestion or sore throat, but if you drink too much, it can raise your blood pressure, lower your potassium levels, and cause heart problems. Experts say that eating more than 100 milligrams of glycyrrhizin, which is the active ingredient in licorice, every day can be risky. That amount is found in about 2 cups of strong homemade licorice tea, depending on how it is made. So if you drink 3 or 4 cups a day, you might be getting more than your body can handle. Another example is turmeric. It is often used for joint pain and inflammation, but taking high doses, more than 2,000 milligrams a day, can cause stomach upset and interfere with blood-thinning medications. To give you an idea, 2,000 milligrams is equal to about 4 teaspoons of turmeric powder. That might not sound like much if you are using it in cooking, but it adds up fast if you are taking supplements or homemade capsules. Too much of a good thing can quickly become a bad thing. This is even more true for older adults, because your liver and kidneys do not work as fast as they did when you were younger. This makes it harder for your body to process and remove extra substances. The second danger is interactions with other medications. If you are taking blood pressure pills, diabetes medications, blood thinners, or heart medications, you need to be very careful with herbs. Some herbs make your medications stronger, some make them weaker, some do both depending on how much you take. Let us take St. John's wort as an example. It is a plant that some people use for mild depression, but it can interfere with more than 50 medications. It speeds up the way your liver processes drugs, which means that some medications leave your body too fast and do not work as well. These include drugs for the heart, for mood, for infections, and even for cancer. Ginkgo biloba is another herb used for memory, but it can thin your blood and increase the risk of bleeding, especially if you are already taking aspirin or warfarin. Mixing these without medical advice can lead to dangerous results. Even something simple like garlic or ginger, if taken in large amounts every day, can affect blood clotting. That is why it is important to keep your doctor informed about every herb and supplement you are taking, even if it seems harmless. Let us continue exploring the dangers of DIY herbal remedies for older adults. The third danger is allergic reactions. Just like some people are allergic to peanuts or shellfish, it is also possible to be allergic to herbs. An allergic reaction might be mild, such as a skin rash or an itchy throat, but in some cases, it can be very serious and even life-threatening. This is called anaphylaxis, and it can cause trouble breathing, swelling of the face or tongue, and a drop in blood pressure. If you're trying a herb for the first time, especially one that is not common in your usual diet, it is important to watch how your body reacts. Some people might not react the first time they take something, but develop a sensitivity over time. The older we get, the more carefully we need to observe changes in our health. The fourth danger is damage to the liver or kidneys. These two organs act as filters in your body. They help remove waste and break down substances, including medications and herbs. But many herbs can stress these organs, especially when used in high doses or over a long period of time. For example, comfrey is a plant that has been used for joint pain and wounds, but it contains substances that are toxic to the liver. In fact, comfrey is banned in many countries for use in teas or pills. Some people still grow it and use it at home, not knowing the risks. Another herb that can stress the liver is kava. Kava is used to help with anxiety and sleep problems, but there have been many reports of liver damage, even in people who used it only for a short time. Your kidneys also work hard to remove waste from the blood. Some herbs, like high doses of parsley or dandelion root, act like diuretics. That means they make you urinate more. While this might sound good for reducing swelling, it can also lead to dehydration and make it harder for your kidneys to do their job. The fifth danger is delaying proper treatment. This is one of the biggest concerns. When you use herbs to treat serious symptoms, you might feel better for a short time, but if you are not treating the real cause of the problem, your condition can get worse. Let us say you have chest pain and you take a herbal tea to help you relax. Maybe the pain goes away for a while. But if the real cause is heart disease, waiting too long to get medical help can be very dangerous. Or maybe you have trouble breathing and think it is just allergies. You take peppermint oil or eucalyptus. But if it is really a lung infection or heart failure, you need medical treatment, not just herbs. The sixth danger is contamination and poor quality control. When you buy herbs online or from an open market, you cannot always be sure what you're getting. The herb might be old, stored in poor conditions, or mixed with other substances. Sometimes, harmful bacteria, heavy metals, or pesticides are present. For example, a study in the United States found that many imported herbal products contained unsafe levels of lead and mercury. These substances can cause long-term harm to the brain, kidneys, and nervous system. Older adults are more sensitive to these toxins. Even when the herb is not contaminated, there is no guarantee that it contains the amount of active ingredient listed. One batch might be strong and another weak. This makes it hard to know how much you are actually taking. Next, let us talk about some specific herbs that can be risky for older adults. First is St. John's wort. As we said before, it is often used for mild depression, but it interacts with many medications. It can make drugs like blood thinners, heart pills, or antidepressants less effective. Some people who take it also experience anxiety, dry mouth, dizziness, or upset stomach. Second is ginseng. This is used to improve energy and focus, but it can raise blood pressure and blood sugar levels. If you have diabetes or high blood pressure, this herb can make your condition harder to control. It can also interfere with sleep and cause headaches. Third is ginkgo biloba. This herb is used for memory and circulation. It can thin the blood and increase the risk of bleeding, especially if taken with aspirin, ibuprofen, or warfarin. Older adults who have had a stroke or are at risk for falls should be extra careful. Fourth is licorice root. While it can soothe a sore throat or help with digestion, too much can raise blood pressure and lower potassium levels. This can lead to muscle weakness, irregular heartbeats, and even heart failure in severe cases. Fifth is valerian root. This is often used for sleep, but it can make some people feel groggy during the day, and it might interact with sleep aids or anxiety medications. It also affects alertness, which can increase the risk of falls. Sixth is comfrey, which we already mentioned. It can damage the liver and should never be taken by mouth. Some other herbs to be careful with include kava, ephedra, also known as mahuang, golden seal, yohimbe. Each of these can have strong effects on the body and should not be used without medical advice. Now let us go over some of the most common mistakes people make when using herbal remedies at home. One mistake is thinking that natural means safe. Many people assume that if something is made from plants, it cannot hurt you. But many drugs, both helpful and harmful, come from plants. For example, digitalis, which is used to treat heart problems, comes from the foxglove plant. In small amounts, it helps the heart. In larger amounts, it can kill. Another mistake is using old or spoiled herbs. Herbs lose their strength over time. If you are using leaves that have been sitting in your kitchen cabinet for years, they may not work. Worse, they might grow mold or collect bacteria that can make you sick. A third mistake is mixing too many herbs at once. Some people think that if one herb helps, combining several will help more. This is not true. Herbs can interact with each other just like medications. Combining them without understanding their effects increases your risk of side effects. A fourth mistake is getting advice from the wrong places. The internet is full of herbal advice, but not all of it is safe or accurate. Just because someone has a big following or a beautiful website does not mean they know what they are doing. Always check with a trained medical professional before trying something new. Now that we have looked at the dangers and mistakes, let us talk about what you can do instead if you are thinking about using herbal remedies. First and most important, talk to your doctor or pharmacist before starting any herbal product. This includes teas, capsules, tinctures, oils, or even herbs you grow in your garden. Bring a list of everything you're taking, including vitamins and over-the-counter drugs. Your healthcare provider can help you understand what is safe and what is not. Some people feel nervous or embarrassed to tell their doctor they are using herbs. But it is very important. Your doctor cannot give you good advice if they do not know what you are taking. And remember, the goal is not to stop you from using herbs. It is to help you use them safely. Second, try to use products that are tested and standardized. That means the amount of the active ingredient has been measured and checked for safety. Look for products with labels like USP verified or consumer lab tested. These labels do not mean the product is perfect, but they do show that some basic quality checks have been done. If you are buying herbs at a store or online, choose trusted brands that have been around for many years. Avoid buying herbs from unknown sellers on social media or websites that do not provide contact information. Third, always watch your body for side effects. If you start a new herb and notice changes in your mood, stomach, skin, sleep, or heart rate, stop using it and call your doctor. Even mild symptoms like dry mouth, dizziness, or tiredness can be signs that something is not right. Fourth, keep a list of everything you take. This includes prescription drugs, over-the-counter medicines, vitamins, and herbs. Bring this list with you to every doctor visit. It helps your doctor see the full picture and avoid dangerous interactions. Fifth, if you are already taking several medications, be extra cautious. Your body has to work harder to process everything. Adding herbs can increase the strain on your liver, kidneys, and heart. Now let us talk about how to use herbs more safely, in case you still want to include them in your health routine. Here are some tips. Start with a low dose. Just like with any new medicine, it is best to start small and see how your body reacts. For example, if you are trying ginger tea for nausea, Begin with half a cup instead of a full cup. Wait a few hours and see how you feel. Try one herb at a time. This helps you know what is working and what is not. If you take 3 herbs and feel sick, you will not know which one caused the problem. But if you take just one, it is easier to understand how your body responds. Use herbs from trusted sources. Buy from pharmacies, grocery stores, or well-known health stores. Avoid herbs that look dirty, have a strange smell, or come in unlabeled bags. Avoid mixing herbs with alcohol. Some people make tinctures by soaking herbs in alcohol. This can be very strong and hard on your liver, especially if you already take medications that affect the liver. Do not use herbs every day for a long time. Most herbs are meant to be used for short periods, such as 1 or 2 weeks. Using herbs every day for months can lead to build-up in your system and increase the risk of harm. Store herbs properly. Keep them in a cool, dry place away from sunlight. Do not use herbs that look moldy or have changed color. Check expiration dates. If you buy herbal capsules or teas, check the dates before using them. Old herbs can lose their strength or grow harmful bacteria. Let us go back and compare some dosages with real-world examples so you have a better idea of how much is too much. For turmeric, we mentioned that 2,000 milligrams per day is a high dose. That is equal to about 4 teaspoons of turmeric powder. If you use it in cooking once in a while, it is fine. But taking daily capsules that contain high doses can be risky, especially if you take blood thinners. For vitamin D, some people think more is better. But the safe amount for most older adults is around 800 international units IU per day. That is about the same as eating 3 ounces of cooked salmon or about 3 slices of canned tuna. Taking more than 4,000 IU per day without medical advice can harm your kidneys and raise calcium levels too high. For ginseng, a common dose in capsules is 200 to 400 milligrams per day. But some teas and homemade powders can be much stronger. Taking too much can raise blood pressure, cause headaches, and lead to insomnia. For peppermint oil, using a few drops on your skin or in a diffuser is usually safe. But drinking peppermint oil or swallowing capsules with high doses can cause heartburn and affect how your stomach muscles work. It can also interfere with certain drugs used for acid reflux or stomach problems. Another herb people often ask about is echinacea, used to boost the immune system. The suggested dose in studies is around 900 milligrams per day, divided into 2 or 3 doses. But some homemade versions may contain much more. Taking too much can lead to nausea, rashes, and dizziness. Also, echinacea can affect the liver and should not be used for long periods. Let me also talk briefly about CBD and cannabis products, which some people consider herbal. These are not legal in every area, and their effects on older adults are not fully known. They can cause drowsiness, changes in mood, and interact with medications for blood pressure, sleep, and anxiety. Always talk to a doctor before trying these products. Finally, let us close with a few real-life examples to help explain the risks. One older man was taking a blood thinner for his heart. He started drinking ginger and garlic tea every day because he read it was good for circulation. After a few weeks, he had a nosebleed that would not stop. The ginger and garlic were thinning his blood even more, without him knowing. Another woman had trouble sleeping and started taking valerian capsules she bought online. She felt very sleepy during the day and had trouble walking. One day she fell and broke her hip. She did not realize the herb was making her too drowsy. A third person was using turmeric for arthritis. He felt better at first, so he started taking more. But after 2 months, he had stomach pain and yellowing of the eyes. Tests showed signs of liver stress. He had to stop using the herb and take medication to recover. These are not rare stories. They are common. Most people mean well. They want to feel better without side effects, but they do not know the risks and they do not ask for help. Now let us finish with a quick summary. Herbs can offer some health benefits, but they are not always safe, especially for older adults who are already taking other medications. The main dangers include taking the wrong dose, harmful interactions with drugs, allergic reactions, stress on the liver or kidneys, delaying real treatment, poor quality or contamination. You can protect yourself by talking to your doctor before using herbs, using trusted products, starting slow, watching for side effects. keeping a complete list of all your medicines and herbs. And most important of all, remember this: natural does not always mean safe. Herbs are not just plants, they are powerful substances. Use them with care, with knowledge, and with support from professionals. Thank you for watching, and please share this video with someone you care about. Stay informed, stay safe, and take good care of yourself.